CEO of the World Travel and Tourism Council. The WTTC has been a leader of the global travel industry for decades. And throughout the COVID-19 pandemic and under Gloria's leadership, they have done some really excellent work on global health and safety standards on a campaign, #TogetherInTravel. That really heightens and highlights what this industry is all about. Gloria, thanks so much for partnering with US Travel on this important discussion. And thank you so much for all that you're doing to help the industry thrive. Over to you.
Thank you, Tori. Good morning, good afternoon from London. Great to be here, and what an honor and pleasure to join this session with USA Travel and the wonderful job that this association also has been doing. As you know, WTTC, as Tori mentioned, we represent the global private sector. For 30 years. We have been able to speak as one voice. These are some of our member CEOs, a little bit over 200 CEOs from around the world are our members, including, of course, Roger, that is part of our executive council. Chris Naceta is currently our chair globally, and our vice chair for North America is Arnold Donald. And we have representations from all the industries. Now, according to our data, as we do for 30 years research, these are the numbers from last year. We measured 185 countries around the world, and I can tell you that 10% is the contribution globally for travel and tourism. And as you can see in that chart, for the last 9 consecutive years, travel and tourism has outpaced the growth of the economy. And of course, last year was not the exception. We grew 40% more, which is 3.5 versus 2.5. 330 million people around the world depending on our sector, which is 1 in 10. And the most important number that I like to highlight here is when you look at all the jobs in all the industries, all the sectors around the world that they were created in the last 5 years, 1 in 4 were in travel and tourism. 1 in 4 new jobs, that's the contribution from our sector. Now, unfortunately, we're heading to a worst case scenario. As of now, 121 million jobs have been impacted. And it's going to be by the end of this year in 197 million jobs if we don't resume international travel. And that's why we're here today. We need to work together to resume international air travel. And there are some interesting lessons learned from the past. We launched a report last November that includes some situations and some analysis. And let me highlight 3 lessons from the charts here. We look at 90 different crises. If you look at the top left, the green line is the GDP for travel and tourism. The white line is the economy. The blue bars are jobs. There are 2 past situations that have impacted the most our sector. One was 9/11, where you see on the top left, and the other one is the financial crisis in 2008. The difference between those 2 is 9/11. We took longer to recover for travel and tourism. This is what we call a U shape. And then in the financial crisis was a V shape. It was faster. It was 18 months. There are a couple of factors for that, but 2 very important lessons learned. And that's what I celebrate, that we're here today working so closely with USA Travel and with all of you. The first one is that we need to have international coordination. 9/11, unfortunately, we didn't have the ideal international coordination on public and private collaboration. And it took us longer to rebuild trust from the travelers because the protocols implemented in some countries were different from the first countries that implemented protocols, as an example. It took us longer to rebuild, as I say, that trust, and it was a painful recovery. Now, the difference with financial crisis was that we had the G20 as an interesting platform where we were able to work together, public and private sector, and in that case, we were able to recover in 18 months, as you can see there. Now, I can highlight your attention to the top right, you will see that's the G20 countries. We don't need to get coordination in 150 countries around the world, which is more complicated for the UN system. But if we work together, a few countries, like the G20, for instance, it will impact the world. As you see, the recovery is exactly the same G20 than the world. Now, let me highlight really quick the bottom right, which is an outbreak. I just want to highlight an outbreak that China had in 2003, which is interesting. Despite that they didn't have a vaccine, they were able to recover pretty fast, which is basically telling us, because it's not only the outbreak that we have seen, we have analyzed 11 different outbreaks like SARS, MERS, Ebola, H1N1. In every single situation, we were able to recover. Travel and tourism was able to recover as long as we can isolate infected people. So if we move to the next slide, basically lessons learned from our studies and research These are 4 principles that we need to execute in order to resume international travel and in order to move forward. The first one is this coordinated approach. We are part of an ecosystem that we work together, and we need to make sure that the ecosystem works together. When we reopen borders, when we remove travel barriers, it is very important to do it together, so that we need to figure out how to remove the quarantines, for instance, and replace them for testing. How do we open air corridors, as an example? The second one is we need to look at the seamless travel journey and the seamless travel experience. The US has done a fantastic job with biometrics, with all the trusted travelers, and the use of the seamless technology. For instance, CBP, I'm very impressed with the work that they have done for years, and Roger has been a great advocate with Tori on these solutions. And we see that there's a before and after the vaccine. Before and after, because once a vaccine is available and widely spread, the experience is going to be perhaps a little bit similar to what we have right now, with just some different components in the case of having a certificate who has received the vaccine. Before the vaccine, we cannot afford not to travel. We need to figure out how do we travel, how we resume international travel, and just include in the experience the testing component. And you will hear today from experts how they are doing this testing before departure and how successful that model is to avoid exporting and importing the virus. Of course, adoption of protocols, standard protocols, is key, and continue with the support from governments that we have received. So if we move to the next slide really quick, let me talk about the protocols. We heard from USA Travel, how they work with CDC. We work with WHO. Our hotels, as here you have some of the logos, they offer rooms to doctors and nurses around the world. And while they were offering these rooms, they were able to maintain those installations COVID-free. That knowledge went to the protocols. And so far, 11 protocols have been defined, including the guidelines from ICAO that we adopted for aviation, for instance, for airports and airlines. But the point here is that we are consistent in the experience. A hotel in London should offer the same experience that a hotel in New York or Washington or Florida or Madrid, for that matter, so that we can rebuild trust from the traveler faster. And in that case, that's why we put together these protocols, the private sector and all of our companies, 200 members from around the world. And then our members created the Safe Travel Stamp to identify the destinations and the properties that they have implemented the protocols. Now, let me tell you about a unique opportunity that we have. I think that we are aligned with governments. We want to avoid exporting and importing the virus. We want to reduce the impact to millions of livelihoods. As I said before, so far 121 million people have been impacted globally. And I'm sure Roger will talk about the US numbers, but it's unimaginable, that number. We want to avoid a longer recovery. We want to avoid a U-shaped recovery and try to have a V-shaped recovery. And we want to reduce the significant impact, because there are people that have been impacted, especially SMEs, which is 80% of our sector globally, and also 50%, 54% actually women, and 30% youth. So we need to make sure that we help the sector, all these small and medium enterprises that they are depending on travel. And unfortunately, it seems that they might need to close their business. And that's what we want to avoid, and as long as we need to resume international travel. In October 7, we made history with this unique opportunity, because for the first time ever in the G20 meeting for ministers of heads of tourism from these countries, we presented a plan that where the private sector was invited, 45 CEOs from members and non-members of WTTC put together, where basically has 12 commitments from the private sector and 12 things that we need from governments in order to resume international travel, which is very related to the conversations that we're going to have today. The first one is a coordinated approach, as I said before, to reopen borders. Very important to do that in coordination with the private sector. What is the benefit of opening a country if we don't work with the private sector, of course? The second one is we need to have an international testing protocol so that we can replace the quarantines. Only the people that tested positive should be put in quarantines. We should not have quarantines per nationality, per passport, or for country of origin. There needs to be a quarantine only for tested positive. And that's what we believe is more productive. And of course, let's try some air corridors. What about the London, New York air corridor, or the Germany, US, or France, US, or there are so many others that they were looking in order to move people between the US and Europe. We need to get this right. And we believe only by working together, we will get there and actually make it happen. So it's very important for us to be here today with all of you. And just to close my remarks, what I believe is that we need to continue sharing accurate data, positive data. For instance, IATA shared last week that this year, 1.2 billion passengers have traveled in 2020. 1.2 billion. And out of those, we only had 44 COVID cases confirmed. And confirmed is probable, but this is before the protocols and before wearing a mask. Before we implemented the protocols and before we were wearing a mask, 44 confirmed cases, which is basically 1 in 27 million, which tells us that flying is still the safest way of transportation. And we need to communicate that everywhere around the world and to the traveler, especially as we build this traveler's confidence. The traveler needs to be comfortable that we're taking care and reducing the risk as much as possible, as we also work removing travel barriers with governments, and of course to promote travel, like the Let's Go There campaign that the Travel USA has been doing, which is very successful. Last but not least, let me share with you a quick video that we announced recently, because we want to put things in context. It's not only the jobs that we create, the benefit of the economy, it's also the social impact. So I'll play a video right now and then back to Tori. And thank you for joining us today again.
What does travel mean to you? Exploring the world? Creating memories? Meeting new people? Disconnecting from it all? But what about making a difference? Because our travels mean so much more than we realize. And those memories we've created together in travel, they're even better than we thought. Remember that restaurant where you'd never felt so full? Know that when you paid your bill, you helped feed your waiter's family of 4. And that time you stared open-mouthed at that incredible dance. You maintained jobs that keep important cultures and traditions alive. Travel is not just life-changing. Travel is world-changing too. That photo you took on safari, the one that hit new levels of likes, your trip supported the tireless fight against the illegal wildlife trade. Remember that spontaneous city break? It helped maintain schools in the local area. And your tour guide, the one who made you laugh so much, she is one of millions of women employed in a sector leading in gender equality. Remember how you made a difference when you traveled? Remember how much your travels meant to others. Now, just think of all the good you can do in the future. Travel the world. Make a world of difference.
Thanks so much, Gloria. No matter how many times I see that phenomenal video, I get chills. So absolutely well done. And Gloria will join us again at the end of this presentation to answer questions. Please feel free to submit any now that you may have for her on the chat function. Our next speaker is Roger Dow, President and CEO of U.S. Travel Association, who will talk more about what we've been doing from a U.S. perspective and what initiatives we've been working on here to restart international travel. U.S. travel has been really at the forefront of this pandemic in the U.S. since day one, working around the clock to secure relief for the travel industry while planning ahead and looking towards recovery initiatives and stimulus proposals. Roger has had a long career of overcoming national crises, and his leadership during this health crisis has been absolutely critical for our industry. Thanks for being here, Roger. Turning it over to you now.
Well, thanks a lot to my colleague Tori, who's really been helping lead our effort in the United States. And also thank to you, Gloria, and WTTC. Gloria and I only talk twice a week and have been for the past 30 some weeks, every single week, talking with folks around the world is how we're gonna work together. And thanks for all of you who've joined this. This is so critical, what we're about to talk about and have been talking about today. As we near at the end of the year, which is absolutely, as we all know, the worst year we've ever faced, we're working on a new forecast for 2020 and beyond. And in fact, as we're speaking, we're working on that forecast. And unfortunately, I have to say it's worse now than we thought during the summer, especially when it comes to international and border closings. International, we're now saying is going to be down 79% versus 64% that we thought this summer. 2019, the US enjoyed 79.3 million international visitors. The projection now is saying 2023 will probably have 66 million visitors. So not even back 2023. Now, I'm not sure I personally agree with that because these are what the numbers are showing, but I also know this industry pretty well, and we'll talk about that in a minute. We will get through this. There's no question about it. We're going to get through this. We're all seeing domestic travel improve a bit. We're such a resilient industry, and we still have so much to do, especially when it comes to international. If we don't restore international, we're not going to restore this industry or our global economy. Simple as that. It really starts with a worldwide commitment to health and safety of all travelers. And Gloria's mentioned that. And that is whether it's at the airport, whether it's in flight, whether it's a trip you're taking within a country, your leisure opportunity, going to an event or a large trade show. Our big event called IPW, 6,000 people, is going to be in Las Vegas live in September. But we're waiting for all the world to open up so we can have that event. In May, we brought the industry together and 30 organizations came together, and we issued health and safety guidance, which got boiled down to transmission barriers, enhanced sanitation measures, health screening for employees and for customers and guests, food and beverage best practices, and it's an ongoing effort. And each segment of the industry is continuing to enhance those guidances for their particular segment of the industry. On the guidance, there's 2 points I want to make. One, masks are essential at the present time. Now, I want to see these masks go away. It's uncomfortably flying across the pond wearing a mask. So I want to see them go away. But right now, we all have to work together until we can get this behind us. Department of Defense basically says, U.S. Department of Defense, that you're safer on a plane and the chance of transmission is extremely unlikely, which Gloria's numbers also supported. Yesterday, the research was released from the group called the Aviation for Public Health Initiative. And their research finding was a layered approach to sanitation, to ventilation, gate to gate, really takes the risk down exponentially. You're safer on a plane than you are at a grocery store or dining out. And we've got to share that word that everyone gets to know that. We're aggressively urging travelers and residents to all work together to do the things to prevent these risks. We released a campaign called Travel Confidently in the US, and it's a campaign that basically an industry-wide effort to talk about the shared responsibility that we all have, not only our industry, but the travelers, to have a safe and healthy travel experience. It's very similar to the WTTC Safe Travels program, which I commend Gloria and her team for putting together, and so many people signed on to that. Providing travelers with the assurance that they can be safe traveling, and all knowing that that's the first step that we're going to have to all take together to get the world moving again. But it's not the only step. Increasing in COVID-19 testing is critical to the future of travel, especially international travel. U.S. travel has consistently said broad brush quarantines where travelers must be quarantined no matter what for 14 days just cannot be the answer. States and countries imposing new restrictions is not the right direction to go if we're going to bring back our jobs and our economy. The collateral damage to communities, to workers is huge, and we cannot bring back leisure or especially business traveler group when people think they might get quarantined somewhere for 14 days. Simple, they're just not going to go. So we've got to get them behind us, and this broad brush approach has to go. Also, we can't have a broad, inconsistent patchwork of quarantines, masks, testing. That just makes it incredibly difficult for travelers to plan or book a trip. Consistency is the only way we're going to get there for international travel to open. But we can't, in the process, compromise efficiency, and we can't make travel more confusing. We've got to have consistency. The current border closures around the world even make it more difficult to open up international travel. So we really have to work together, as Gloria said, with governments to get those border closures released and get people traveling again. We also, the longer this pandemic goes on, the worse it's going to be impacting on travel worldwide. So instead, we've got to really push hard, and we are pushing hard for rapid, reliable testing. That's at airports, at airlines, and that's starting to roll out both for passengers and employees. And that's going to be a critical part of opening up international travel and restoring traveler confidence. More than half of travelers in the survey that we've done are either somewhat or much more likely to fly if all passengers and employees were tested negative for COVID immediately prior to taking a trip. When it comes to groups and conventions, 41% of travelers say they're somewhat or much more likely to attend a conference if employees and attendees tested negatively. So we're working closely with various partnerships here in the US government on potential ways to reopen our borders. We're working with the Homeland Security, the Department of State, the Transportation Department, and the White House. All together, the industry is working to get these things opened up. This interagency group, along with the CDC, is looking at testing and pilot programs to reopen flights like you're going to hear about between New York and London. And we still have some challenges to go with CDC regarding quarantines, but this type of reopening is where testing will really play a role in reopening both airlines, international travel, and we're calling for that along with the airline associations, all the airlines, the Airports Council International. We're seeing this happen in San Francisco and Tampa. United Airlines is also doing it for some flights, and we're seeing this, and we support this, but we need to expand this to all our gateway airports. We're convening our membership and our Gateway Airport Council, the largest airports in our country, with a dedicated workforce, a workforce just to address international travel. We've got to expand the framework like we're talking about between New York and Heathrow. It's one step, but we've got to make more steps to reopen our borders safely and resume international travel. As I started out, if we don't resume international travel, we will never bring back our global economy. Tori, back to you.
Thanks, Roger. Sorry for the delay there, the challenges with Zoom. Thanks so much to both you and Gloria for your insights on these important issues. Would like to bring both of you back to the conversation and also introduce our other panelists. First, I'd like to welcome Huntley Lawrence, Director of Aviation for the Port Authority of New York and New Jersey, who oversees the air system for JFK, LaGuardia, and Newark, one of the busiest international air networks in the country. He spent over 30 years with the Port Authority and brings a wealth of knowledge to our conversation today. Thanks so much for joining us, Huntley. And our final panelist, Erin McMillan, Managing Director of Operations, Policy, and Support for United Airlines. Erin's been with United Airlines for more than 20 years and knows the ins and outs of international air system better than just about anybody. Thanks so much for joining us, Erin. Once you both get on screen, I will start the questions. Huntley, if you want to turn on your video, if you can.
The host has stopped it. I have to wait for the host.
Okay. Rachel, can you let him in, please, or let him turn on his video?
Yeah.
And while you do that, I will go ahead and give the first question over to Erin. Let's start with you, Erin. As you look to the future of air travel, what's United's main focus been in restarting the travel recovery?
Thanks for the question, Tori. And first, before I get started, thanks to Gloria and Roger and both the WTTC as well as US Travel for having me today. I'm happy to participate. Our main focus in terms of restarting travel and throughout the pandemic over the past few months has really been on ensuring the health and safety of our customers and employees to make sure that their journey throughout the travel experience is keeping them safe as well as our employees along the way. And there's 5 key components that we've been focusing our work and efforts on. And the first is cleaning and disinfection. And so obviously that's top of mind for the public at large, but certainly the traveling public when they think about being confined on board an aircraft. And so we've enhanced a lot of our cleaning protocols. We've implemented electrostatic spraying. We're evaluating the use and deployment of antimicrobials, UV light, a number of new cleaning technologies to help make sure that customers understand that both our facilities and our aircraft are clean and safe and following top tier standards in terms of hygiene. The second component is around going touchless. So how do we support our customers through their travel journey by minimizing human to human contact points? And so certainly with our app and a lot of other cool technology and process changes, we've been able to implement things that help reduce some of those touch points that will help make people more comfortable. We've implemented touchless bag tagging, where customers can check a bag on the app and print their bag tags without touching any devices or interacting with an employee, as one example. A third key component for us has been social distancing. So while that may be difficult on an aircraft, certainly in our ground-based facilities, there's a lot of opportunities for us to do that in terms of how we rearrange and set up our lobbies, the gate areas, our clubs and lounges, making sure that we're spreading out seating, using signage and a lot of advanced messaging to make sure that people are keeping their distance. And in conjunction with wearing that mask that Roger touched on earlier. Fourth component is really around air quality and ventilation on board the aircraft. Roger mentioned the Department of Defense study that came out a couple of weeks ago that we were happy to support and participate in, that really has proven that being on board an aircraft is really a very safe place to be compared to other activities that people engage in day to day, in conjunction with HEPA filters and all the other policies and procedures. And then lastly, which I think is really the big focus for today and where we want to spend some of our time on, is around the concept of testing and tracing. And so we have been a real big leader in this space and a huge advocate for the implementation of pre-departure testing as a way to replace border restrictions and or quarantine restrictions that largely exist today that are inhibiting people from travel. And so we have put together a really large team and are doing a lot of great work to focus on different ways on how we can implement this on our own in some cases, but also how do we engage various government agencies and industry experts to help support this type of process in advancing opening up of travel markets and getting people back in the air again.
Thanks, Aaron. Gloria, do you have a question for Aaron as well?
Yeah, thank you, Tori. I wanted to ask Aaron, as we spoke some time ago, and he shared with us the trial that they were doing between San Francisco and Hawaii. Now that there's some data and evidence, I was just wondering if you can share any results. How is that going? And that you guys were like one of the first ones to announce that. Can you share more details about the success and what have you found?
Yeah, absolutely, Gloria. Happy to. So some number of weeks ago, the state of Hawaii started to move forward with relaxing their own quarantine restriction and replacing it with a pre-departure testing program. And we had been actively working on setting up a process to be ready for that. It's something that they had been talking about, had been delayed for some time. And so what we've done specifically in San Francisco is partnered with a couple of testing providers. And we have stood up testing locations, one physically on site at the airport in the international terminal. And the second is a drive-through facility that we've set up in a nearby space over at our maintenance base at the San Francisco airport. And so while it's not mandatory, it's completely voluntary program. Travel has not been restricted into the state of Hawaii. But if you don't show up now with a proof of a negative test result, then you're still subject to the 14-day quarantine period. And so the landscape of restrictions and requirements that exist out there that was touched on earlier is very complex. If you look at the international arena, the types of tests that are required vary from country to country. The time limitations on when you need the tests are really complex. So we felt that by providing a direct option to our customers that we would hopefully make this simple for them and make it a lot easier. And so effective October 15th, those testing options went live in San Francisco. On that same day, we also increased our schedule of flying because there was obviously a lot more demand. And we've seen a great customer response. And so locally on the ground, our on-site rapid testing is largely done day of with our partner GoHealth. Customers sign up, make an appointment for their test, and get it 2 to 3 hours prior to departure. And after getting their results, they head upstairs and are on their way. For folks who choose to sign up and make an appointment for the color testing option at the drive-through facility, they're taking their test in a 48 to 72 hour time frame prior to their arrival in Hawaii, go through, get their sample taken, and then they get their results delivered to them electronically via email and an app that Color has set up. And we have seen great demand from customers, wildly exceeding, I think, even our initial expectations. So much so that we're working with GoHealth, actively to increase the number of machines, staff at that facility, to keep up with the number of walk-ups that we're getting as well. And so we are really bullish on this whole aspect of pre-departure testing, and having seen what it's done for us in Hawaii and what it could do, in other international travel markets. And so, like we on a call earlier today with some media folks, we've seen a near doubling of demand for travel to Hawaii because of the loosening of that restriction. And by putting these processes in place, it's really helping to stimulate demand, but do it in a very safe way that's reassuring to people.
Thanks, Aaron. And I know from having talked to some folks at the Convention Visitor Bureau in Hawaii just last Friday, it sounds like they've definitely seen a huge uptick of incoming guests there in Hawaii. So great news on that effort. Next, I'll ask a question to Huntley. From your perspective, Huntley, how has the global pandemic forced the airports that you oversee, one of the largest systems, to really rethink the future of air travel?
Well, at first, I want to thank Gloria Guevara for really an outstanding presentation, and really taking a global view on what's happening with the industry, and Roger Dow for their very, very thorough presentations. It really reflects a lot of the thinking in the Port Authority as well. So I do want to say I appreciate seeing those presentations very much. There's been a significant and dramatic, change in the way we look at our business. In the most, fundamental to the most complex ways. We have been on a journey in New York to create world-class facilities, world-class airports. We're doing it at LaGuardia, creating a completely new airport. We are putting up a new terminal at Newark Liberty International Airport, and then we have aspirations to completely redevelop and transform JFK Airport. So what we have to now consider is how are passengers going to travel through our facilities in a different way. You've heard concepts about travelers wanting a touchless experience. Our surveys are saying the same things. Customers want to go through our facilities and they don't want to have to touch anything if possible. We have to think about building facilities for social distancing. Well, many of you know that most airports in the United States and across the world have a reasonable amount of space around the ticketing area and also at the checkpoint for security. But we have to really rethink the space requirements and how we're going to manage the situation in the future if we're going to be in this situation with COVID-19 for a prolonged basis. So we have already built in new design requirements in the new Terminal B at LaGuardia Airport. And we are now evaluating design standards for the facilities that are going to be opening at Newark Airport, Newark Terminal 1, and also for JFK. We recognize that there are significant concerns about the cleanliness of surfaces and minimizing person-to-person interactions to the extent possible. So we are now experimenting with virtual assistants, having virtual airport customer experience specialists, and and also implementing things like touchless payment systems for food and beverage and retail areas. Obviously, we're certainly putting in physical barriers and at those locations, but now we've got to really have an end-to-end touchless experience. So if you go to our website, we focus on being able to provide information with a chat bot so customers can ask questions about COVID-19. We have a video so customers can understand what to expect in their journey from a safety standpoint. But what we're going to have to be able to do in the future of facilities is to make sure that we have a coordinated approach between airports and airlines. So folks understand that in every segment of their journey that there's coordination between airports and airlines, that as you go into any of our facilities, it is safe for travel. And that extends through the gate facilities and also on board the airlines, that we're both kind of saying the same message and are aligned on making sure that travel is certainly very, very safe. Airport employees are going to have to engage customers in a different way. They're going to need to be knowledgeable on the safety protocols and be respectful of customers that really want to interact in a different way, in a more distant way. And that's going to be a little bit unusual because most interaction is sort of face-to-face, and that is going to be different, but we are retraining our employees at our airport with our We Soar program so that they can all understand that in the future, as we are experiencing now, we're going to have to engage customers in a very, very a different way. What we've learned through this particular process, as we've set standards across our 13 terminals, there's a real important focus on engagement with industry, engagement with stakeholders, and having a common and aligned communications strategy so that end-to-end customers understand what they can expect and customers can have confidence in our facilities.
Great, thank you, Huntley. That's really, really important. Roger, I think you have a question for Huntley as well.
Yeah, first of all, I don't envy Huntley and his colleagues running the most complex airport system in the United States, but they do one heck of a great job. Huntley, I got a question for you. When you talk about international travel, obviously we've all keep saying that first and foremost is protecting America and containing the virus. But what specifically are you doing to ensure, one, that you have the right testing? Maybe talk about testing, and what other capabilities are you putting in place for when the U.S. and the British government agree on this air bridge flight between New York and London? Talk about testing and other capabilities you're putting in place and how you figure out what testing company you use, et cetera.
I mean, I think it really starts with ensuring that we are talking to health policy experts and understanding about the testing protocols that are currently in place. But we are partnering with public sector, the City of New York, and also the health departments in New York State and also in New Jersey on different testing protocols. So at our airports, you may have heard of a company called Express Spa. They used to provide massages in airports. Well, they have rebranded themselves, and now they are providing COVID-19 testing facilities. So we have a COVID-19 testing facility at JFK that is run by the private sector. And we also have the public sector with the City of New York providing testing, COVID-19 testing facilities at JFK. At LaGuardia Airport, we have the private sector providing a facility in the next month or so. But right now, we also have the City of New York that's providing COVID-19 testing at the airport. On the New Jersey side, we've got the private sector providing COVID-19 testing for employees. But in each instance, we are also focused on more rapid testing for employees and also for passengers and making sure it's widely available, and looking at ways in which we can reduce the footprint of the COVID-19 testing centers so we can have them more available in our terminals. Some of the facilities are a bit larger, and now we're focusing on more pop-up facilities that we can actually make available in more terminals. But I think that the key partnership with the private sector and the public sector, and the focus of widespread availability of testing at the facilities is what's most important, and ensuring that the appropriate testing protocol is in place and ready and tested and true, tried and true when the policymakers and public health experts are aligned and ready to proceed with the air bridge concept. We think the air bridge concept makes a lot of sense, but obviously there's much more work to be done, as you heard from Gloria and also yourself, about the alignment of health policy and travel restrictions. Today, there's a complete patchwork of different travel restrictions, oftentimes because there is a difference in the infection rate in certain places, and state governments and federal governments and countries are trying to protect their citizens. I think as we're ready to focus on the air bridge concept, we need to make sure that we are aligned on testing protocols, whether it's 5 days of a negative test, or it's diagnostic test, or the antigen test. We just need to make sure that we're aligned on policy, and also aligned on whether we can test out for quarantine. So we're making sure that our facilities are prepared, and we're making sure that we're available to work with the various governments once we get closer to an aligned policy.
Huntley, that's very helpful, and I know lots of conversations going on in between different countries and states, and the opt-out question for sure. We have had a number of questions come in into the chat, so I'm going to put one out there right now, and I think this is probably for Aaron. If we agree that discretionary air travel passengers will remain reluctant to board aircraft, that despite all onboard measures are still likely perceived to be transmission points, and given the increased adoption of on-airport pre-flight COVID testing that you all have talked about, with results in approximately 30 minutes, will airlines be prepared to deny boarding to those passengers who test positive for the virus? In this way, all on board can have a higher assurance of the viral health of each flight.
Thanks, Tori, and that's a great question. And the short answer is yes, absolutely. The last thing that we would want to do is put a known positive case on board an aircraft. And while it is a very safe mode of transportation, and everything that we've done and have in place is keeping people safe, and the environment is safe with the airflow and all of those great things that we've done, you don't want to purposefully introduce that type of risk. And so we've seen a couple of instances of this with our San Francisco testing, and we've got great protocols in place and procedures with our testing providers to isolate those individuals, make sure that we're engaging and providing proper notice to local health authorities and the CDC, and following all the standard protocols to make sure that we're keeping everyone in their immediate environment as soon as we get their test results, but also protecting them from getting on board an aircraft.
Great, thanks, Aaron. A question here for Gloria. Why are the governments taking so long to take in suggestions regarding safe travels? Gloria, as you noted, the G20 countries, unless the governments take the suggestions and ease traveling, it will create the inability essentially to travel. So what's your take on sort of the G20 process and where those governments are from a timing perspective?
Thank you. That's a great question as well. The governments in general were very supportive with the plan that we put forward, but unfortunately there is not a lot of data, and some of these countries are requesting the data first, but this is like the chicken and the egg, right? If we don't have the air corridor, for instance, between London and New York, which is the most important hub pair in the world, and have the testing before departure, is more complicated. There's a lot of data on testing on arrival, and that's the data has been shared. United, as Aaron mentioned, was one of the first to launch that, and that data is helping us now to support the case. Lufthansa and others are also gathering data as we speak. But the governments here are relying on the health officials. And as one government official in the US told me, and I thought that was an interesting comparison, he said, you need to understand that what 9/11 meant to the safety and security officers or officials in the governments is the equivalent of COVID for the public health experts, right? They were not prepared. They didn't know what to do at the beginning, and there was not enough data at the very beginning. Now we know more, and unfortunately, the balance between health and the economy is not there yet. So governments are also struggling and making the right decisions. And I think that we need to change the narrative between just containing the spread to, as I said before, coexisting with the virus while we contain the spread and we resume travel. So I'm really hopeful. I have seen some good indications of governments, but we are not there yet. And all the work from the entire sector, especially like USA Travel and all the associations from around the world in helping us in convey that message is going to be crucial to move in the right direction so that we don't have the numbers that Roger shared for the US and I share globally before the end of the year. That's a very good point, Tori.
Thanks, Gloria. Roger, this one's for you. Does U.S. Travel advocate for a federal response to COVID testing?
Yeah, we're pushing very hard for to have rapid testing and make it a high priority. And it's just not us, it's among multiple, everyone involved in travel realizes this is the link to travel. So we're pushing extremely hard to make this the highest priority the federal government can be. You have it rapid, available, economical, and in place. So it's one of our highest priorities. So there's no question about it, Tori.
Thanks, Roger. And I know you, along with over a dozen of the corporate CEOs, sent a letter to the president calling for a federalized testing regime. So really, really important leadership from the industry calling on the administration to do that. Huntley, a question for you. Given how complex the situation is, what do you foresee as the greatest potential challenges that the industry should be aware of when it comes to reopening international air routes?
I mean, I think that, what we've all said already is, the importance of alignment on policy. That's really number one. Number two, ensuring that we have agreement on the types of tests that are essential. So I think, the question that you just asked, Roger, is an important one. And that may require, the federal government to set a standard, but you want to have COVID-19 testing capabilities that are located in terminal and convenient for passengers to access. So if it's going to be available on arrival, we've got to decide whether it's going to be in federal inspection areas, it's going to be outside in the public area, but recognizing that it's going to be very, very important that we coordinate on the location of these facilities. Test out procedures are going to be critical to boosting the recovery. We know that across the globe, governments have set up quarantine restrictions. So we're going to need to make sure that that issue is resolved. And then ensuring that all entities understand the risks that are involved and accept the mitigations, that have been put in place at their respective ends of the journey, right? We all have to agree that, once we get into this, we have to accept the risk based on good science, good health policy. That's what we see as the most complex issues that we really, and challenges that we really need to address. And obviously to make sure that our employees continue to be safe as well. We can't, forget about the importance of ensuring that employees are going to be safe as we do these, this change in process.
Great, thank you. Huntley, another question for you. Will the training at LaGuardia JFK Airport serve as a suggested protocol as the footprint for preparedness training? And if so, when will it be available in other cities with international airports? Will these protocols be shared or suggested with the cruise industry for consideration going forward?
We're talking about training of employees?
Yes, the training. Yes.
Yeah. So the training that we are focused on providing to employees is really about, in addition to the training that employers may provide employees, whether it's an airline, a service company, a cleaning company. We overlay certain training with respect to customer experience. And also we are overlaying, certain training with respect to standards for cleaning and things like that. We have very, very robust procedures for cleaning, disinfecting surfaces, sanitization, very robust procedures and measures in place on social distancing, the installation of plexiglass. All of that is good, but without having it reviewed by an outside entity, then it's just processes that may not necessarily work well all the time. So we are actually on a journey to have an outside group through the ACI process, AHA, the GBAC process, to really focus on how we can improve our facilities over time. And that training is really something we're doing locally in New York and New Jersey. And obviously, being a member of ACI, certainly exchange with other airports what we're doing as at our airports. And we do this as a regular process, as a regular level of communication with ACI and also AAAE. We talk about measures at our airports, and we exchange, best practices and ideas. So I would say that other airports would be doing something similar as we roll out our training in New York. But many airports are also focused on the accreditation programs, whether it's ACI, AAAE, or the new SkyTrack process.
Thank you. Aaron, I think this one's for you. I guess within the airline industry specifically, what barriers are you all seeing for a coordinated effort for international travel with regards to testing and tracing? Are you all aligned? Is there kind of a coordinated effort? Maybe you can't talk to that, but that comes up, and a couple of people are asking about that.
Yeah, I think it really comes down to, I think, certainly United. We talk with some of our peers and other carriers in the Star Alliance, and I think that there's certainly widespread acknowledgement and belief, just like there is with Gloria and Roger and the organizations they lead, that pre-departure testing is the key to opening up these international markets. I think, but the next step, and where we don't see as much progress sometimes, is bilateral discussions between those government institutions. And certainly they've got their hands full in just dealing with the pandemic in and of itself right now. And so, we're hopeful that by doing different things, by, launching our pilot in San Francisco and looking to expand that opportunity to our other hubs across the US, we're evaluating other pilot opportunities that could potentially draw some attention to this type of effort. The pilot that we did last week with Common Pass, I think, is a good example that got a lot of attention and press coverage, and hopefully that helps spark those conversations between the governments to get them in the same camp as the rest of us, that this is going to be key to starting to open up these travel markets that'll stimulate the economy and get people traveling again.
Thank you. This one might be for Huntley, but then maybe Gloria, you might have some thoughts on conversations between the governments in the air bridge concept, from the funneling through New York, between New York and London. Has there been conversations around having other, a funneling, so other Europeans that would fly through UK to US for that pilot, or other US states or areas that would come, be able to fly from New York to London? Or are you seeing that it's solely, or the discussions kind of solely in the context of, UK residents and New York residents?
Huntley, do you want to go first, and then I can add?
Sure. I think the discussions that we've been involved with are really focused on specific routes between New York and London. And there's been no discussion up to this point about funneling, passengers through New York, or funneling passengers into Heathrow for flights into New York. I still think there's a lot more work to be done in terms of coordination of policy, but right now we're just really trying to see if we can get this one link to work. So those are the kinds of discussions that we've been involved with so far.
Yeah, I agree, and to complement what he just said, from our end, as we're very engaged also with as well the UK government and the testing protocol that they are defining. This is a corridor that we need to get it right, because it's the most important one, as I say, with the 2 city hubs in the world that has the largest volume of travel before COVID in the world. And it's very important also for the business traveler. We need to, we're in the process of helping to provide input to define the protocol, which is the testing before departure, and in some cases, even testing after arrival. And of course, wearing the mask and all the protocols, and when and how do you do the test, and what type of test, and all those questions have to be answered, but it's very important to get this right now. However, we also know, and we are aware, because we engage with a lot of governments, not only the G20, but 150 governments around the world, but specifically in the G20, Italy is ready and very interested to have an air corridor with the US. They have already in Fiumicino Airport, for instance, testing on departure, where they are trying with Milan. Paris is ready to do an air corridor with the US as well. They have testing on departure in the Paris airports. Frankfurt is ready as well. Frankfurt has been doing testing between Frankfurt and Vienna, for instance, testing before departure and on arrival, and they are ready to test that with the US. So there are a couple of countries, Spain as well, in this part of the world that would like to resume connectivity with the US. And as Hutley say, it's very important here, the policy, and have these 2 sit together, coordinate. These bilaterals are crucial so that they can define the rules. And I think the rest of the world will follow. But it's very important for these governments to have these interactions and have exactly what is needed to make this happen. And we provide the data with the information from United and the information from the airports authorities and everyone that we have been gathering.
Thanks, Gloria. Aaron, what important opportunities for airlines have risen out of the various challenges that the COVID-19 pandemic have created?
That's a great question. So I think from an opportunity perspective, it's really for us been a lot about innovation, right? I think there's things that have come up throughout the course of the pandemic that obviously us, the Port Authority, anyone in the travel sector has had to deal with as part of just keeping the operation going. But I'd say we've been really creative, I think, in a lot of the things that we've done in terms of the cleaning and hygiene protocols that we put in place, and really have taken a leading position, I think, in our overall response. And I think the testing is a great example of that, with things like that we've done in San Francisco, steps we're taking to expand that to our other hubs, the Common Pass pilot. We have a lot of other things in the work that I won't talk about or can't talk about right now, but we're really excited about on how we continue to draw attention to this important concept, and be creative in finding solutions, right? We foresee the need to continue with these types of protocols, just because although there's talk of a vaccine, until it's really widely available worldwide, we're going to need to continue to run our operation and transport people safely, and help get people back to doing the things that they love to do, but make sure that it's safe. And I think everything that we've done to date has been a reflection of that, and really see these testing protocols and some standardization as being a really key and critical element in helping support that.
Great, thanks, Darren. Roger, this one's for you. U.S. travel's position on liability protection, where the importance of liability protection for travel businesses.
We think liability protection is probably one of the most important things to getting travel moving again. It goes both ways. One is You don't want to have an airline, a destination, a restaurant, a hotel, theme park, where someone frivolously get a lawsuit and says, I got COVID because it was your fault. And we unfortunately do live in a world that's litigious. But even more important is for corporate travel policies. Companies right now, when the pandemic started, told their people, don't travel, don't go to meetings. So we've got to unwind that. And having liability protection is going to be one of the things that's going to be important for corporations to say to their people, okay, travel, because they're going to have their lawyers saying, well, do we want them to travel? What if something happens? And just like anything in the world, we've got to have the protections in place. And I don't care whether it's drive your car or insure your house, business, but liability protection is going to be very important, at least in the United States for sure. And we talk about it with WTTC around the world to getting travel moving again.
Thanks, Roger. For Gloria, how can the industry support the efforts that you are discussing to ensure implementation?
I'll align with the message. I think the industry can help us with aligning the message, and aligning the message is changing the narrative from containing the spread to learning to coexist with this. Is based in risk assessment, right? It's like safety, as Roger mentioned. No one can guarantee safety, not even in my house, right? And we learn to live with that. Well, flying, driving a car, riding a bicycle. We need to learn to also manage the risk and understand that with this challenge that we're facing with COVID. So it's very important to educate yourself, understand, and the industry help us to communicate to the travelers that you have more possibility, as Roger highlighted at the beginning, to get COVID if you go to the drugstore or like a supermarket, like flying in a plane. This is still the safest way of transportation. You have more possibilities, perhaps in a restaurant, I don't know, or in some places than in an airport, right? And we need to get the facts and the data and just help us to convey that message, and help us to also push the governments to help us to resume international travel, because the more loud that we are with the data backing us, I think it's going to be faster. And the next couple of weeks are crucial, to tell you the truth, not only in the US, but here in Europe and international. But to me, if we get this right between the US and Europe, as I said before, the rest of the world will follow.
Thank you. So maybe, a question that each of you all might consider here, for each of you. Obviously, there's no silver bullet when it comes to reopening air travel, from testing to quarantines to agreements between foreign governments. But one constant through this is the continued social responsibility, individual responsibility of each traveler. How do you communicate the importance of the role of the traveler in a safe air travel experience? So maybe we can start with you, Huntley, and then go to Aaron, and then Gloria and Roger.
Well, I think that, as travelers are thinking about going different places, we've got to understand the various forms in which they are booking their flights, or in which they're dealing with a travel agent. And I think, to me, that's where we start to ensure that our message around, individuals wearing masks, focusing on social distancing, focusing on, personal behavior is going to be key and important across their journey. But more to the point, that as they go through their journey, whether it's in an airport or it's in an airline, that they're going to be safe. There should not be anything that's going to contribute to their concern about traveling as they go through that journey, provided that they follow these accepted practices. And I think that it is important to have an aligned message across each of the distribution points, right? So if you book a flight on the United Airlines app, customers should be able to understand the entire journey, what's going to happen at the airport, what's going to happen on that flight, and you can see all the different safety protocols. However, it's also going to say, you know what, you have to agree to wear a face mask on that flight. You have to agree to wear that face covering in that terminal. It is all part of the commitment, to your safety as you make your way through our system. So it's alignment of message and also continued reinforcement of the principles that are going to make people safe. And I'll just say that for us in New York, it's important to note on face coverings, we believe it is so important that now that those who do not wear a face covering at our airports, at our facilities, could be subject to a $50 fine. We were very, very early in implementing a face covering policy, but now we have added a fine to it. We were very early in saying that there is restricted access to terminals only to ticketed passengers, but all of these measures need to be communicated, not just through my distribution network, but through the travel associations, through airlines, with an aligned message.
I completely agree with Huntley's comments and remarks on this particular topic. I think we can do everything under the sun to keep customers and employees safe in the airport environment and with the things that Huntley and the port have to deal with, as well as what we need to do in our parts of the facilities and onboard aircraft. But certainly, the human factor plays a really big part, and a lot of the things that Huntley touched on we have in place. So during the booking process, we inform customers of expectations on mask wearing and not traveling while ill, and there are self-attestations and acknowledgments that we force customers through in the check-in path. So within 24 hours of travel, they essentially have to attest that they're symptom-free and acknowledge that they'll agree to wear a mask in our ground-based facilities and onboard the aircraft. And it really does come down to communication. We push a lot of messaging to our customers so they know what to expect of the airport travel experience and what to expect on board. A lot has changed, and we're welcoming a lot of new people back that haven't traveled in quite some time, and it's very different. And we want them to understand what to expect and why we've taken those steps to keep them safe. And so, onboard videos, email messaging, test messages, we've deployed a chat bot, tons of different things to engage our customers to make sure they're well informed about everything that we've done, but also understanding their responsibility as being a passenger on United Airlines and being with us. And we're happy to have them, but those steps are important, and we expect them to live up to that.
I'll chime in. I agree with both my colleagues here. And everything we do in life is individual responsibility. If you think of it, we have all sorts of things in place for driving a car, but it gets down to the individual driver's responsibility not to drive recklessly, not to get out of lane. When you go through TSA, people have learned they have responsibility. Take that out of your pocket, do this, do that, and they learn. So in everything we do in life, when you go to a college, you have responsibility. So I think this is just one more thing where it goes both ways. The traveler and the industry working together will solve this thing much more quickly.
Totally agree with all the comments, Tori. I think they cover everything. And just to add, is the traveler should be part of the solution, which is if we go back in history, when we had the situation in 9/11, we had to educate the traveler so that we can rebuild confidence. We need to go to the same exercise, but it's, as Roger says, they are responsible, they are part of the solution. And if we don't get this right together, they might impact the recovery. So the traveler is a very important part of the solution. They need to be with us and understand that their decisions have an impact.
Great, thank you. Thank you so much. And we have so many more questions, so we will circle back to folks. We'll get answers to all of the many questions that are in the chat. But as means of time, I am going to say thank you so much to Huntley and to Aaron for being with us today. Really appreciate the insightful perspectives that you all shared, and really hope that this can be another step forward in opening up international travel and then helping to give confidence to those who want to travel and who are ready to travel. We hope that they'll make plans soon to travel. With that, I'm going to move over to Gloria and then Roger for concluding remarks. Again, thank you so much for being with us.
Thank you for joining us. This was excellent. We appreciate the expertise from the guests and the experts. And as Roger said, we're in this together, and we will get over this situation, the biggest challenge that our industry has faced in our history. But it is very close that just through collaboration and joining forces, we will move in the right direction. We really hope that we can resume international travel before the end of the year. And from WTTC, we'll be continue partnering with USA Travel, that is doing a wonderful job, and all of you, so that we can bring back the millions of jobs and livelihoods that have been impacted. Thank you.
And I'll close by, Tori, you thanked everybody. I want to thank you for the great job you've done juggling people from 5 different cities. It's terrific. But I want to thank the folks who've joined us today, because that's the industry is really what makes a difference. And it's so critical we bring the international back, because without it, we don't have an economy in the world. And, you know, there's a song lyric, Billie Holiday years ago said, "The difficult I'll do right now, the impossible will take a while." And that's what we're working on. We're gonna work on the impossible. It'll take a little while, but we'll get there. And looking at Gloria's numbers earlier, I think travel's like a coiled spring. You saw 9/11, you saw 2008, you saw SARS, and what did you see? And each one, it boomed back stronger than ever, more quickly than ever. So I'm confident that we're gonna come back more quickly than anyone thinks. I'm a big proponent. It's not going to be 2024. It's going to be far sooner. And if we all work together, we're going to make that happen. So thanks, everybody. We really appreciate your joining us.
Thank you so much. That concludes our presentation today. We will again share the responses to questions, and this has been recorded, and you'll be able to review it in the future. Thank you so much for being here, and have a great, safe day.